welcome to our online event looking at partnership working through digital transformation. My name is David McGuire. I'm a senior analyst in the policy team here at the King's Fund. Thank you very much for joining us, and an extra special thanks to our event sponsor. This event is being sponsored and funded by RSM UK. I've got a great panel of speakers with me today, which I'm going to introduce and allow to introduce themselves to you in a second. But I should say we're not just restricted to the video here. There's full bios for our presenters in the right-hand side of the screen. And there's also a tab for resources nearby as well. We're not just restricted to in the room. Please also have a look for the Slido feed on your screen. That's how you can send through questions to us, which I'll be keeping an eye on for when we get to the panel discussion. You'll also see some polls, the first one of which will be starting soon, and we're really keen to get your feedback throughout this event so we can put what you need to find out about to our panel so that we can find out from you as well. I'm just going to quickly introduce everyone and give them a chance to say hello to you as well. First of all, I've got Dr. Amanda Begley, who is the Director of Digital Transformation at the Health Innovation Network. Amanda, thank you very much for joining us. Maybe just a quick bit about what you do.
Yeah, certainly. I suppose I've worked in from frontline and commissioning and in a range of provider organisations, and the last 15 years have been very focused on innovation at scale and transformation. So it's great to be here. Looking forward to the discussion.
Thank you, Amanda. And next to you is Ade Williams, who is Superintendent Pharmacist and the Non-Executive Director at Southern Health NHS Foundation Trust. Ade, same for yourself.
Thank you very much. So my name is Ade. I'm a community pharmacist who based in Bristol, who also sits on the board of the Southern Health Foundation Trust. Key part of my role is looking at how primary care, especially community pharmacy, can be better integrated to address the varying degrees of health needs in community, and technology, digital innovation, and how it can transform care is an area that I carry much as a big passion to see how we can deploy that to good use.
Thank you. And Tim Brazier, Managing Director at Thrive by Design. Tim, please.
Yeah, thank you, David. So I'm Managing Director, but mainly a designer at Thrive by Design. We're a small team that are part of the NHS. We're hosted by Leeds and York Partnership Foundation Trust. And we're a design and research team, and we focus on two things really. One is how can digital technology and innovation with digital help to tackle health inequalities, while at the same time the flip side of that is how do we ensure that the digital transformation of health and care that is happening and is going to continue to happen doesn't compound existing inequalities and make things worse for people. So yeah, that's us.
Thanks, Tim. And working our way on down the line, we've got Sheila Pancholi, National Technology Risk Assurance Lead for RSM UK. Sheila, if you'd like to quickly introduce yourself.
Thank you. Afternoon all. So I'm Sheila Pancholi. As you said, a partner at RSM. I lead our technology risk assurance practice, so have been working in the healthcare sector for over 12 years now. Very much working with all organisations across the sector to really think about the interoperability of systems, focus on some of the key risks around digital transformation, how do we drive sort of better information through data, and a whole host of other challenges that arise around technology. So yeah, really looking forward to being part of this panel today.
Thanks. And squinting to see each other from far ends of the room are myself and Sarah Rank, who is Assistant Director of Business and Technology and Adult Social Services for Norfolk County Council.
Thanks David. Thanks for having me here today. So I have responsibility for the technology strategy within Adult Social Services, work closely alongside the Norfolk and Waveney ICS, and also co-chair the Eastern Regional Digital Group, and I'm part of the LGA and ADAS digital strategy group. So really good to be here, and looking forward to the conversation.
Thank you, Sarah. And we've got, as you can see, a quite diverse panel with us today, so we'll be able to cover quite a broad range of areas. Just to quickly say, one of the things I forgot, you can join in on Twitter with the hashtag KFOnline. So please do if you're on social media, or at least that kind of social media. So I'm just going to work back through the panel again with a quick discussion maybe to kick things off as questions start to come through on Slido. If I maybe come to you, Sarah, to start off with as somebody working in that interaction between health and social care, what do you see in your role as some of the key barriers to data sharing and digital transformation? Because we're talking about breaking down some of those organizational barriers, and when we've chatted before, you had some thoughts about what had become possible during COVID that were quite powerful.
Yeah, I think if we go back to the COVID, I think COVID gave us, when we first went into lockdown, it gave us such an opportunity, thinking around the COPE notices. So by having that, it enabled us to share data that we probably haven't been able to do so before. So where the county council, we work alongside our district colleagues, and within 2 weeks we were able to set up a vulnerability hub, so a Norfolk vulnerability hub which helped for those who are extremely clinically vulnerable. There's about 43,000 people, and we got that set up so quickly that had we not had the COPE, if we'd not had that relaxation in the rules, it would have taken us far longer to do that. But it enabled us to get prescriptions to people, to get food packages and food shopping, and also for those that were isolated and lonely, because we were able to identify them so quick. And it's something that we've been able to build on. So we've gone from the vulnerability hub, we now have with the household support fund and the hardship, again working across the board, that has allowed us to do that. What would concern me is to go back. Obviously the COPE notice is now finished, but I think we need to think about how we can continue with that. How do we continue to share that data and not lose that information? I think if we were to ask a lot of our service users, they probably, if they share data with a GP, they probably think they're going to share it with social services anyway, and likewise. So it's about really building on that and making sure that our citizens don't lose out because we've lost that COPE. So yeah, just build on there.
Thanks, Sarah. And to move on then to you, Sheila, because you work around a lot of risk assurance and some of the debates around that can happen. I can remember during the pandemic working on a piece that we interviewed different people working around digital technology, and they had some similar thoughts to Sarah. I had one CEO at a CCG say, it's fantastic, we can do so much more quickly, and their CCIO in a separate conversation said, I'm going to pull back the reins as quick as I can because I'm really worried about this. What are some of your reflections around this?
Yeah, I mean, picking up on Sarah's point, absolutely, we've seen some great collaboration that's happened during COVID, and as you say, we don't want to lose those opportunities. Unfortunately, as you say, David, though, there are still quite a number of risks that need to be considered, but also some challenges as well across the organisations. I mean, right now, we don't have the interoperability between systems. We don't have the interoperability between organisations. We don't have those, the connectivity that would allow us to share data readily. And I think over and above that, there's this huge question about actually, from a patient's perspective, how wide do they want that data to be shared? How much visibility are they going to have of that? How are they going to actually be able to know what's being shared with whom, when? I mean, I think over and above that, when we think about data in its sort of rawest sense, we've got to think about actually, is the data even accurate? Have we got one version of the truth, or actually are we going to be sharing things where you've got some discrepancies in what's being shared between various organisations? How can you safeguard it? The majority of the data that we're talking about it's person identifiable, actually it's special categories, there's a lot of sensitivity around this data. So just thinking about what safeguards we need to have in place as well. And yeah, I mean, huge numbers of challenges, let alone just thinking about actually, is there a digital strategy? Does data form part of that digital and transformation strategy? Who's going to drive it? We talk about sort of the ICS, there's obviously some role that the ICBs will be playing in this as well, but how do you bring those strategies together, and how do you get everybody talking about data in sort of that sort of one sense, one version of the truth, and thinking about what does that look like? So a fair number of things to think through.
Thanks, Sheila, and that I think tees me up for what I was going to come to you about, Ade. That idea of who is driving things and how do we make this happen. I think a lot of people are very interested in some of the practicalities of starting to move things forward. I think my question was, how do we engage and develop more practical solutions with clinicians and those more widely across, especially community services, because the acute sector takes up so much of the focus. But as someone who's working in the pharmacy sector, you've got a bit of a different perspective on things.
Yeah, yes, and not surprisingly, and it's not in conflict actually, because where we sit at is that maybe primarily because of the experience of the pandemic, there is a greater awareness that primary care has this, gateway role into the health care, and how it links very well with social care as well. And we do have a wealth of data sitting in those two forms where we find primary care predominantly, which is general practice as well as pharmacy. But pharmacy especially is now more than ever before recognized as a key part of how the NHS needs to deliver best care. But the integration, the interoperability, the ability to make sure that the standards, information standards that work in our sector are lined up so that we are integrated as things progress may not necessarily be there. There are questions around funding, there are questions around ambition, and there are questions sometimes around actually not being forgotten. The tragedy is that while these conversations are happening, of course, we are also looking at health inequalities and very much looking through that lens, knowing that we need to do more for those that we have underserved and not been able to do our best for a long period of time, who are daily coming into community pharmacies. And we know their stories, we know their information, they will give consent for us to use that to provide better care for them. But the question that we face is the hurdle that we all need to navigate is how do we get that plugged in and doing it in a sustainable, ethical, and also progressive way.
Mm-hmm. I can tell you folks that the Slido poll that we've currently got up asking how effective are current measures in place in your locality in enabling digital transformation, data sharing and partnership working is sort of in the middle towards negative, unfortunately, in terms of the poll responses. Amanda, I was going to turn to you next on that idea of developing long-term partnerships, making it happen, building around the wider goals of the health system rather than the maybe more narrow organizational focus that we might individually take.
Yeah, so I think I'll sort of change track a little bit and talk about partnerships with industry. And those sort of long-term partnerships are really important, particularly when there's a bit of a mismatch between need and supply, like we're seeing in the remote monitoring technology market, and understandably a mismatch because we're still evolving our thinking around what does great look like for our patients and our staff, and there isn't actually technologies out there that can be delivered at scale because they don't cover all the levels of acuity that we need, they don't cover all pathways and conditions. So it's a really ideal space to be thinking about how do we work together and what skills do we need. So industry can bring really deep domain knowledge and developers, and we can bring that real insight into our users and customers. And then we need to add obviously comms and engagement and change management expertise. And I think that can, by working together, we can really accelerate digital transformation. At the Health Innovation Network, which as other AHSNs, academic health science networks, do across the country, our role is to really facilitate and support the building of relationships between industry and the health and care system. And some of the things that we've done recently with working with the London ICBs and with the London Regional Office is to go through a number of stages, I suppose, to help build those relationships. The first has been to interview adopters, particularly clinicians of early use of the remote monitoring technologies to really help raise awareness of where the system is at in terms of their readiness for adoption of these technologies and what their expectations and needs are. And then on the flip side, we've then done an overview of the market, so worked with suppliers to really understand how developed are their technologies on areas that are particularly important to the ICBs, like interoperability and levels of acuity. So sort of helping to each side to understand where they're both at. And then the third piece of work we did was to develop a guide specification that could be used in future procurements for remote monitoring technologies. And that covered a whole range of areas, and we applied the kind of Moscow prioritisation to that, so we could be very clear with industry and with procurers on what are the must-dos and requirements, and then what are the sort of ambitious areas and where our ICBs have different views on what they want locally. And the next stage is then to look at, from that, how do we use that intelligence to build long-term partnerships? And what does that mean from a contractual perspective? So how do we ensure that we're not tying things down too quickly and we're reducing innovative capacity? How do we build those long-term relationships? And how do we really define, from both perspectives, what does value back need to look like? And also thinking about how can we be more sophisticated as customers and suppliers. So rather than talk about interoperability, can we be a bit clearer on what data do we need, when do we need it, where do we need it, in what format do we need it to be, and then work with suppliers to really, for them to evidence to us that they can make that happen, perhaps through a sandbox kind of environment. So it's really a, let's understand each other and where we're both at, and let's think about the mechanisms to build relationships, whether that be through personal relationships and building trust, or whether that be through some of our contractual mechanisms.
I think that idea of give and take is a really important one. It came up yesterday at the Digital Congress here at the Fund, and it's probably something we'll explore a little bit more in the Q&A. So just before I come to Tim, just to say, please do bring in more of your questions through Slido. We are about to turn to them, so the more the merrier on that front. Tim, at the minute it feels to me like we're starting to build up a bit of a set of jigsaw pieces that we'll bring together in the last part of the conversation. We've touched on inequalities a couple of times, and you've mentioned it already. I was struck yesterday by hearing Fiona Edwards, the chief exec of the Frimley system, talk about their focus on health inequalities, but also how that's essentially moving back to the original purposes of the NHS that was set up to be an intervention in inequalities that existed within British society. And when we're talking about digital technology, it doesn't look quite the same as maybe health inequalities might in other forms of access of health care, is it?
No, and I think I was quite struck by that comment yesterday as well, and it kind of I think it made a lot of people kind of sit up and go, oh yeah, that's why we're here, that's why this whole kind of NHS and healthcare system exists. But I think the thing we do keep forgetting why we're doing this, and I think all of this we need to kind of really understand what the real purpose is, what the real benefit of some of this is. So whether it's integration, whether it's interoperability, whether it's digital, whether it's data being shared, well, for what purpose? What are we actually trying to achieve here? And I think the new integrated care kind of structure that's kind of now much more formalised is a massive opportunity, but one that I think we could let slip through our fingers quite quickly if we continue to work in very siloed, very transactional ways across those partnerships, and kind of see it as that's your responsibility, that's our responsibility, and the people that are needed to access these systems being just passed between these kind of things. So you say about a jigsaw puzzle, I think that's a good kind of analogy, but there needs to be, what's the thing that brings that together? And I think we need to start thinking about the thread from understanding what inequalities there are, what they exist, and where they're presenting themselves as well. We have a lot, and I think as the NHS, we understand a certain amount about health inequalities, because they're the ones that we see and we know about and present to us. But there are also so many other health inequalities that exist out in communities, out in real world, that don't even get anywhere near the health system or the NHS. There are so many barriers to them that they're nowhere near that. So how do we use this opportunity of partnerships across the voluntary sector into communities, pharmacies that see this day in, day out, that people walk through their doors? We hear the stories that Adi mentions there. How do we use them to really draw and tell that story of why we're doing this from start to finish, that we've got people here in this situation that need to get from here to here, they need to get to being well. How do we all play a part in that? And then how does digital enable that? And how does digital make that easier and simpler and more accessible for people and more equitable for people? And I think it's just a fundamental founding kind of principle, like say, to the NHS, that we need to kind of get back to a little bit with this and make sure that there's that thread that we can always go back to, because it's really easy with all the individual expertise and specialisms to get really deep in that detail, and we need that, and we need all of that, but we need almost like a safety line to pull ourselves out of that a little bit and always come back to that view of just going, oh yeah, this is why we're doing it, And that's why I need to be talking to these people before me and these people after me, and making sure that we're joining things up in a meaningful way, not just a very transactional way.
Mm-hmm. And I think that also, I'm struck by a little thread that's come through here, which is a lot of the ICSs that we've spoken to have started with data and data quality, to Sheila and Ade's points, and trying to figure out a sort of objective version of the truth that then they can come together and draft objectives around, and then build that sort of shining light in the distance that they're all walking towards. Just before I do turn to the questions on Slido, is there anything else that we wanted to pick up with each other just before we move into the Q&A based on what we chatted about? No? Grand. Thank you very much for sending through your questions on Slido. I've got a big batch of them here, and I'm going to try and work my way through as many as we can here in the panel. I'm going to start off with, and I should also mention that it's not meant to be just a one-way thing coming towards us. One of the things I've always enjoyed about our online events is the opportunities that you will get to meet each other as well through Slido. We've got Clive from RSM, I can see in Slido, but if you want to introduce yourself and maybe make connections based on each other's questions and some of the things that come up, that's a fantastic bit of things that I really enjoy seeing. I think we've got a couple of questions that have already come up. I might come to Tim on this first one because we chatted about it yesterday at the Congress. There's a big challenge in enabling the VCSE sector to be part of the journey of digital transformation. The specific question here is, what does this look like? What are the actions needed and the barriers that we have to remove?
I think it's a great challenge. I think it's something we need to understand. And we talk about like equitable access is something that kind of sticks in my mind. And we need to have a equitable relationship with these partnerships as well. That we don't see this as just a formal version of leaning on the voluntary sector to continue to pick up the pieces that we're not able to. And we actually bring them into this partnership as equal partners so that they can, their voices and the advocacy they do for the people that are out there in communities that are facing the challenges and the barriers and the current health inequalities, that's brought to the table, but as real weight to it as well, and is genuinely influencing the rest of the people around that table. Because if we don't do that, if we just see them as a partner, as a friend that we can call on when we think we need them, then we're just going to be in the same situation. We're just going to continue to assume what they do and what they can do and what they can bring to that partnership. Whereas, truth be told, we talk about innovation a lot. And I think that term gets bandied around a lot without really understanding what it is. And I always go back to, I think I've seen true innovation outside of digital, outside of technology, in communities where people are facing challenges on a day-to-day basis. And they just have to, you have community organisations, people have to support that person with whatever they can put their hand on at that time, the tools, the resources, the people, the experience that they've got. It's experience like that they can bring into this conversation to really help us, like I say, get back to that purpose of why we're doing this and change our thinking a little bit and really put some meaningfulness to the changes that we're doing in the transformation that's happening.
Amanda, I think I saw you nodding at the question as well.
Yeah, so I just joined South West London's ICP, so Integrated Care Partnership open board meeting last week, and they have voluntary sector representation on their partnership board, and there was a real commitment to wanting to work with the voluntary sector, and they have a sort of health inequalities fund and an investment fund, and they're keen to make that, so that they announced that funding. They said it's a bit tight in terms of timescales this year, but they really want to move forward, making and using that as an opportunity to really invest in the local voluntary and community sector. And it does, certainly from my personal experience, my sister's got severe learning disabilities. She was diagnosed with breast cancer, and MenCap sent her a iPad, and it's been phenomenal in terms of her recovery. So yeah, there is it's all about us working together, and there's a huge contribution that we can make, and that perhaps things we might not think of in the NHS is at the forefront of the voluntary sector and community sector's minds. And so, yeah, I think there's definitely a commitment from the conversations I've had with ICB and ICP colleagues.
And to broaden out to the rest of yourselves, anyone who wants to come in on this, Ade?
I think certainly the voluntary sector's role cannot, it's the mistake we've sometimes made in the past is that we will design or come up with solutions and then go to them to help give us an opinion or to us an assessment of it. And I think we almost need to redefine what partnership is, and which is that actually they are the voice of the people, like Tim said, and I think other colleagues said, that we are trying to do the best for. We're not just trying to do it with them. We're trying to do it for the best for those people, and they have a much closer, much more intelligent led and personal led insights into what's going to work. So bringing them in to help us to shape our understanding even of the challenges or the problems, for want of a better phrase, helps us to come up with solutions that are actually the best ones. I think what we've done is we solve some problems, create more, go back again there, and many times we also bring them in almost as this courtesy and take what they say, take it on board sometimes, not take it on board, and they feel very, like your phrase, used in their processes. At the same point, frustrated, and also picking up the pieces from the gaps. So it's that change that we need to do, and that's a change that needs to be something that becomes a core part of the values of how we do things better.
And Sarah?
Yeah, I think just adding to that, so we've got the social care reform coming into effect next year, and the assumption of that is going to be digital by default, and therefore to try and get the voice of the people, to try and understand how do we deliver that, how do we make sure that works. I think you're absolutely right. We need to be working with the voluntary sector, and it's not just us then doing two, it's about us working together, understanding how that is going to work and what we need to do, because you're absolutely right. We'll put something in, and then down the line, what do we know where the professionals were making it work, whereas actually the people who are, if we think around care accounts, we think around all of the changes that's going to bring, it's about us working together as a whole system, not just social care, not just health, but health, social care and the voluntary sector to be able to deliver that.
Just to add, the only other thing I was going to add is, let's not get mistaken by the word voluntary as well. They can't do this for free. They're not here to kind of go and have a conversation with them. They'll tell you everything. They will give you as much as they can because that's what they know. But this needs to be funded. It needs to be properly supported. To Addy's point, we can't bring them in, and we can't do all of this and think they're part of the partnership now, so we can get them to do this and impose things on them. They have to be part of the design of this, design of the future way of working, because if not, it's just going to hit the community sector and they're just going to go, that doesn't work, that doesn't meet reality in any way whatsoever, so it's just going to fall.
Yeah, I think that was one of the points I was going to make, actually. One of my reflections on this is it's not about the big society model. It's not, the state will not be stepping in anymore, so voluntary charitable sector will have to step in. It is, we believe that we should be led by what our patient service users, the public that we work with, the communities we work with want. And that starts to guide our direction. Who's best placed to help us with that? The VCSE sector, along with an exchange of value, as you said, Amanda. Because it's one thing for the NHS to engage in maybe some of the things that we might have seen at a local level about, well, we're asking you to do something for us here, and not necessarily that reciprocity. I've spoken to charities who they've built their own digital records based on open platforms. They've completely gone paperless and can't get an NHS email because they're not seen as being professional enough, and so can't integrate with the rest of the system around them. Or I was struck by a trust that a mental health community trust I worked with recently, who they used the phrase organizational risk. And it seemed very fitting, because their leadership team had a set of objectives that they wanted to achieve around acting as an anchor, around addressing inequalities. And they were talking, chief exec to chief exec with people working in the VCSE sector, and hearing about things that people had suggested and had been turned down by middle management because they didn't feel comfortable about the organizational risk of working with a partner that they weren't comfortable with. So there's definitely something there for senior leaders to be able to feed that down through the rest of their organizations, for me. Just turning to the questions again on Slido, we've got a very popular one from Alexis Farrow. Thank you for putting your name to it, Alexis. How are you overcoming funding and resource challenges to enable the delivery of sustainable digital transformation? So the money has finally come up. We knew we were going to get here eventually. I don't know who wants to maybe take this one on first.
I'm happy to
Sheila?
start. I think the resource challenge is a real one. It's huge, isn't it? It's not just about this sector either. Absolutely, we have organisations, suppliers who specialise in this sector when it comes to technology, and we know they're extremely stretched and under-resourced. But there is actually a resource challenge nationally, globally around technology. So it's a real one. Yes, we might now have the funding, but actually, where are we going to find those individuals who not only understand technology, but actually understand the complexity of this sector? Because it is hugely complex, and we've got this platform of lots of legacy infrastructure and systems and lots of new digital transformation that we're trying to bring in. We know things don't talk to each other. So, having the right people on board as partners is really important. If you're actually going to deliver something successfully, I think what we see a lot of actually is projects that start, a huge amount of funding and time and effort goes into them, but unfortunately they fall over and nothing gets delivered in the end. And this is I think part of the journey as well. How do we, it's not necessarily about, again, the technical resources and the technical specialists, but actually the end to end, there's a big piece around the project management resources in there as well, and that understanding of the sector and the business processes within the sector.
Ade, were you trying to catch my eye on that?
I think you've got a community pharmacist and you're talking about funding, so there could be a very long conversation there. But I think in truth, it's a very valid question, and it really underpins where we are failing at the moment. In that, wherever we talk and all the nice things we've said about primary care, community pharmacy, how do we get their input and really harness that, is that we don't have a funding strategy over the last funding contractual cycles that have actually looked at digital transformation, innovation in there. And I think the expectation is that the contractor model, the contractors will look at this and think this is something very good to do for themselves and for their patients, and they will fund that. Now, when you have very funding, real-term funding costs, where you are in that space, where you're really trying to just focus, and this is, I think, a narrative that is very common with many, many services and many organizations, is you're simply trying to keep the day-to-day on the road. You're not thinking that, we need to start to think and fund a plan and funding for the future. And it's important. It's important that we have very clear direction. We have very co-designed and owned objectives, but also we have that mature conversation in terms of what does each part of this needs to have for this to work, and how do we fund it? And the absence of that, one, means that sometimes we are blinded to people that we need to bring into the room. So community pharmacy is notorious for not being in the room many times. And secondly, we do things that they were surprised when you turn up to find out that you've got something that is really digitally clicking along, and you're coming into a very analog setup, low-cost environment, because that's what the funding envelope has always maintained there. And how then do we bridge that? So I think it's really a real, it comes to that question of, as ICBs particularly evolve and come up with their plans, they need to also own some of that, maybe not necessarily fund it, but certainly become a bigger voice to say, well, this is how things are going to get better, or we will simply keep having areas and people left behind.
Amanda, I was going to come to you about that, especially because we just had contracts come up. So on the first question on resource itself, but also it's quite a popular question here about much of the NHS running on 1-year contracts when it takes months to get things set up, and some of the nuances and the intricacies of trying to stretch that out. I think people are interested in as well.
I mean, what we're seeing with the kind of virtual wards at the moment is there's sort of guarantee of funding for 2 years. And that means we've got to have a business case within the next 12 months to say, actually, is this affordable? Is it viable? Does the system want it? Is it safe? And we need to have evidence not just around, or we need to know not just about what the cost of these technologies are, but the cost and time of implementing them. So that sort of even a 2-year funding cycle was really short in a relatively immature market. And as I said, we're doing this piece of work on long-term partnerships. Anyone who wants to contact me and be involved, contribute to that, do let us know, because we're working it through at the moment. But certainly what we're thinking about is, that kind of stage-gauged approach, fail fast. I think industry are very good at that kind of agility, and let's take this in small steps so that we're managing risk and investment risk. And the other thing we're finding in London in particular is just that working at scale. So not all of the ICBs are testing the same technologies, and there's small teams testing different things, and they're sharing that learning and insight, so that we're not all having to invest in the same sorts of technologies, and that we're developing sort of specifications together and saying what's your must-have, what's your would like to have. So we're trying to do things once, and spreading some of the cost around that, and things like the work across South London and North West around a diabetes platform for education and self-management, where they've all been doing those pieces of work, and now they're pulling together to say, actually, what's excellence look like if we were going to procure something in future, and what have West Central London, North East London been doing? So, and how do we pull resource to make that happen once for London and everybody who accesses healthcare in London? So I think there's a lot that we can be doing around ICPs working across systems, so that we're being a bit more careful with public money.
I think I'm not an expert on this subject in any way, shape or form, but I think there's something, again, just trying to make sure that what are we using the money for? And again, it goes back to that, for what purpose? And the example I've given, it's quite a crude example, is patient portals. We've been told we have to have patient portals in place. Loads of resource getting mobilised and money being spent on that. Who said they need a patient portal? That's the bit that I don't see the evidence of, that people want a patient portal. When we're talking with people with lived experience through various different projects, they're not talking about, oh, this could have been solved with a patient portal. What they're saying is, it's really frustrating that when I go and see somebody, they don't know me, they don't know anything about me, because the information's not being passed on. So it just feels like if we just need to really understand why we're doing this and what the benefits are to people, because then we can start to solve some of them fundamental things. And it came up in a conversation yesterday about getting the basics right first. I know that's a really sweeping statement, but there are some fundamental things when we actually go out and spend some time talking to people with experience, both patients, carers, family members, staff, the workforce. They turn around and said, if they were all clamouring, just going, the missing piece of this puzzle is a patient portal, great, we should go and spend our time on that. But it feels very random, and it feels very kind of, someone's built a patient portal, maybe we should use that. That sounds like a great idea, but I just don't see that that's where we should be focusing our time right now. There's so many other things that should be prioritised.
I think pretty much everybody wants to now come in
Okay.
as well. I'll give Sarah a chance and I'll work my way back down.
Okay, patient portal. Okay, so coming at it from a social care perspective, and again thinking around the social care reform, thinking around the numbers that are going to come our way, and we've got care accounts that we're going to send out. Actually, the portal for us in social care is going to be really key for that. So people can submit we can send electronically the care accounts, people can submit the financial information. So again, but it's understanding why do we want to use it. So for us, it's going to be around making it easier for people, easier for us as an organisation. But again, we don't want to develop that on our own, and it's about working with our partners, working with the BCSE, working with others, TLAB, others, to think, how do we make this happen then? How do we make it so it works for the individual? It isn't just something that as a council we think that's what we've got to implement. So I think from a portal perspective, as I say, from a social care, it's a very, very different slant. But if I may just come back on the other around the sharing best practice, I think that is absolutely key to all of this, that we all go away, we all do things, but let's not keep it here. Let's think, right, okay, so in Norfolk we've done this. I'm more than happy to share with others that this is what we've done. And within the East of England region digital group, what we tend to do every time we meet is do a bit of a round robin. So what are you doing at the minute? What do you want to share? rather than reinventing the wheel, then taking that and even taking some of those business cases and thinking, okay, how have we got that through? Can we build on that and can we do something as well?
Quickly on that, on sharing best practice, I'm sure many of our viewers are signed up to the Future NHS platform, which is a nice sharing tool. I can get access as someone working at the King's Fund. I'm not sure if that was cheeky and I'm not meant to mention it. But if I could get access, then surely others can as well. One interesting thing I just had come up in another discussion recently was the flip side of that, which is sharing when things go badly.
I totally agree. I totally agree.
Yeah.
And I think we should, because again, we start these projects and so often we think, well, we've got to get through, we've got a year, we must do it. Why do we do that? If at 3 months we know it's going to fail, why are we wasting the money? Why don't we stop, pause and think, can we do it differently? Or do we say, no, this isn't going to work? So I totally agree, where things haven't worked, we have to be able to share that as well, because it might not work for us, but it may work for somebody else because they can do something different. So totally agree.
Yeah, although obviously that can be very difficult to do, to admit a mistake. It's a key fundamental part of a learning system. I think Ada and Amanda, you both wanted to come in there.
I think one of the things, I guess, sorry to go back again to the portal, is that one of the real sort of bugbears of all healthcare professionals is how you end up with a duplicity of systems. You have this whole plethora of logins and things, and now something's always somewhere. There's always somebody you need to call to go, where do I find this? And it shows itself usually because there is a good solution for something, but doesn't link up with, because the person doesn't just sit there, the clinical records don't just sit there, they've got a care package, they've got there, and where we don't really solve those things, it also creates this, really sort of antithesis towards those projects, actually, where you hear that, oh, there's going to be this thing coming, and you immediately think, oh, that's just going to make life a bit more difficult for me. And, and there is a sense of, how do we prevent that happening? How do we make sure that when we're coming up with the solutions or we're coming up with designs, we are bringing everybody in that can help us to make it work well. And and it's within our gift actually to do that, to make sure it links in seamlessly, to pull things down now, and also to be future proofing and think, oh, at some point this may come in here. And in the absence of it, what it then does is we end up with complicated systems again, and we then are asking people to live with that. And the only thing that's worse than not having the tools that you need are the tools that you have that you cannot make use of. And sometimes we do that, and then we are creating this complexity. And if it's bad enough for those of us that have the privilege of being able to provide help to people, the people that actually then need to access it, whom we are saying we're going to give you more access to, how would they ever navigate through that? And I think it's just something for us also to just be mindful of, and also to hear those voices and think we need to do those things simpler and better. And actually less expensive as well, I think, in the long run.
Hopefully. Amanda?
So a bit of a challenge on the NHS Futures, really helpful platform, but what's even more important is the relationship building, so that, because people are often too busy to go to NHS Futures, they need to sort of build the relationships with those that are putting information on there, and then that's a sort of repository. But I think sometimes we think we'll create a repository and then we forget about the need to build relationships. I'm just sort of reflecting on the piece around kind of contracts and value, alongside how do we make sure that we bring in the voice and the kind of direction from people with lived experience. And in Health Data Research UK Hub for Cancer, which was funded by HDR UK, DataCan, we had a group of people with lived experience, either with a diagnosis in recovery, with carers, and they reviewed all of the contracts that came in. So industry came with an innovative piece of work or research that they wanted to undertake, and our group then reviewed those contracts and said, and basically gave the advice on whether or not they felt it was a real priority for them as a community, whether they felt that the work would deliver sufficient value back to patients and the NHS system, and whether they were happy for their data to be used in that way. I thought it was just a fantastic model. We wrote into all the contracts that at any time they could veto and stop a piece of work, which was, I thought, a really innovative way to engage with industry, so that we're all very much starting with the understanding of what matters most to the people that we're seeking to serve. So it's just a sort of whether other people are doing those sorts of things, and whether that might be an interesting and useful approach to take.
Amanda, what you've done there is you've set me up for the
This
summary
is
I was
like
about to try. Yes, exactly.
I can't really. It's okay.
You've set me up to try and summarize a lot of the questions we've had come in. So we've had 55 questions come in total, folks. So apologies we can't get to all of them, but we'd also need to extend this for about 4 or 5 hours if we were to come to all of them. I think there's two big themes from my skim through, especially the most popular questions. And one of them is about some of the complexities between organizations that we were starting to get into. People are asking about PCNs, about ICSs, about all of the different partners that you're trying to connect and keep across at the same time, and all of those different directions that you get pulled in. Also a little bit about whether those are set up the right way. Actually, there's one question here that says that that PCNs might be too small. There's some PCNs that are too big. They're not uniform. The other thing that's coming through is a lot about patient voice. It's a lot about what people are able to say about how their data is used and what people are aiming for within the system. Sheila, if I maybe come to you on that first for a couple of quick reflections, and then maybe I'll branch out to a couple of others, and then we'll start towards wrapping up.
I think it's a really, really important consideration in all of this, because at the end of the day, that data belongs to the patients, and any transformation, anything that we're trying to do, building all of this change is fantastic. But I think even when we're talking about, implementing systems, the best way to do that, and I think Amanda mentioned about, the user groups, actually always going back to the individuals who this is going to impact the most. And you mentioned it as well, actually. This is about the patients at the end of the day. Yes, a portal might be useful specifically organisationally or for a number of organisations, but what is it that the patients want? And actually, going back to equality, how are they going to be able to access it? Because I think a lot of the time we talk about, let's develop a great app, or, let's do something really whizzy. And we always seem to fall back on this term innovation. And when we think innovation, we immediately also think technology and transformation, digital transformation. Innovation is about change. It's not necessarily technology change. It's about doing something and making it easier for somebody to access. And that's why I think going back to the whole piece around equality, that change has got to be accessible by everybody. And I think that's really important, because technology isn't always accessible to everybody, and our patients aren't always going to have access to technology.
Anything else around this, Amanda?
Yeah, I think the LICRAs, I'm going to forget what the acronym is, Local Health and Care Records exemplars have done some fantastic work around engaging with the public on how they want their data to be used. So I know One London commissioned a great work on which involved a series of kind of citizens panels and a deliberative exercise to really understand what was acceptable and not acceptable in relation to how the public's data was going to be used. I know Camden Council has done some great work on setting sort of principles with their communities on how they want their data to be used. So I think there are growing examples of engagement work. And going back to the earlier point about how do we use resources effectively, is how do we draw on some of that intelligence and then think about what are the gaps and who do we need to engage because of the community that we're seeking to serve. So I think it's starting to improve. There's still a lot more that we need to do, but I think there's more and more insight that's coming out we can draw on.
And I think we're now starting to head towards time, because we've got only 10 minutes left here. And I wanted to give a little bit of space at the end, sort of gather things together and maybe try and hand something off to people just before we leave them and they leave us. I'll maybe start with you, Sarah, and work our way down here. What would be your one takeaway that you wanted ICS leaders, those across the system, to leave with today? And what can they practically do to collaborate around their digital strategies that enables more practical ways of working through digital technology?
I think for me it's around working together. So it's health, social care, BCSE. It's all working together for the citizen. At the heart of all of this is a person. We will all need services throughout our life. So it's about making sure we're not in those silos. We're joined up. It's about having that opportunity where we're joined up. We're thinking about the individual at the heart of all of this. And you're right, around people think about transformation as always being technology. It's not always that. It's about working, looking how we can do things differently, but doing it together. And I think that's the thing. We don't want people to fall through the net. We've heard stories before where people fall through the net between health and social care. So therefore, it's about working together and being joined up.
Sheila?
I think for me, data sits at the heart of all of this. How do we capture all of this data from across, this whole ecosystem? How do we maintain it to ensure that actually it's accurate? And then how do we share it in an effective way? Going back to sort of, thinking about, okay, well, if we develop some of these systems and, we've all got access to them, actually, we're all going to want consistent reporting from them too. And what do we want that reporting to look like? Are they going to be dashboards? What information are we going to want to hand? How are we going to get access to it? How often are we going to want access to it? So, that strategy really needs to think about what data does as part of that, sit at the heart of it.
I can tell you, Sheila, you're popular amongst the viewers. I'm just reading the poll results at the minute, which you can find to the side of the screen, folks. What do you see as the biggest opportunity to support partnership working in digital transformation going forward? Number one response so far, having a shared set of standards and consistency and quality across data sets is number one. Tim, just as we turn to you though, second place is better links with those outside the NHS, including community groups in the private sector.
Yeah, and I think that's obviously we've talked about that being incredibly important and being done in the right way, and an honest way and things like that. But again, for me, just coming back to that, what's the thread through all of this? And it's why we're doing this. So whatever we're doing, whatever decisions are being made, whatever projects are being funded, whatever kind of programs are running, can we literally just think why? And try and find the human reasons why we're doing this. And if we can have that as a way of going back to it, I think it will help that. The focus of it, it'll help make sure we're using resources in the right way, and it will make sure that we bring the right people into that conversation and into those partnerships, because we'll understand what we're missing. If we understand the why we're doing it, we'll understand who needs to be there to ensure that kind of.
Thanks, Tim. And Ade, back to the original question again. What's the one takeaway that you'd like people to take away from today, the discussion we've had, your experiences so far in your career? I
think certainly embracing the value-based relationships as the key to this, realizing that for the people that we so desire to do the best for, their trust, our willingness to engage with them, and also for the broad range of health and social care partners that needs to come together, there has to be this real sense of that you are valued, and that's really replicated or represented in both how your voice, how the funding, and actually how your input is brought together in looking at the solutions there. I think it's the only way that we're going to really start to see technology and digital innovations as transformative in terms of improving the things that we do. Otherwise, what we do we end up just using it for operational efficiency or operational urgency there, or that perception of that. And I think trust, true value-based relationships is the only way that can change that narrative.
And finally, Amanda, please.
So I suppose I'm reflecting on just how difficult everything feels at the moment for our citizens, for the staff working in the health and care system, for people in the voluntary community sector, people in small businesses. it's incredibly hard. And the one thing that innovation gives us is hope. And so it can be incredibly energizing, and it can really bring people together. So, but we're only really going to make it happen if we draw on all of the expertise that we've heard about from our panel and others. So, and totally agree with you, that's about building relationships and about building trust. And then we can hopefully realize some of the ambitions and try and solve and crack some of these really difficult problems that we're facing.
Yeah, I think that's a really strong point, Amanda. It's similar to what was floating around in my mind. You'll notice I've used my chair's prerogative to give myself the final say here. But I was reflecting on it's really tough in a lot of ways to justify working on something that isn't hammering down your elective lists, sorting out your A&E performance at the minute. Well, a lot of transformation is about solving those things down the line. And your business case might not be one that saves money as the core objective. It is about fulfilling your purposes to the populations that you're trying to work with. It's not an EPR, for example, for an EPR's sake to hit that national target. It's actually about doing something that requires an EPR to make transformation happen for me. Folks, thanks very much for joining us. We've had 63 questions come through. Apologies for not being able to get to all of them, but also we weren't going to be able to make it, sorry. Thanks very much for joining us. Thank you to our panel as well. Thank you to our sponsor, RSM UK. Just a quick note to say that you can share a link to the event with colleagues who aren't able to join us in the moment. There's already over 1,000 people who have signed up, but this link will be valid for another few weeks to watch on demand. We're really keen on your feedback, like I mentioned earlier, so please do fill in the survey that we'll be sending through later on. But there's also a feedback tab that you might be able to find near the resources as well within the webpage. So once again, thank you to our panel, thank you to RSM UK, and thanks to yourselves for joining us today. Goodbye.